We're now going to move on to our first panel. I'm very pleased that we have Philip Alston joining us. Hello, Philip. Can you hear us? Great, I better get out of the way. We have Philip Alston, who is actually joining us direct and live from New York right now. So, Philip, it's great to see you. Philip Alston is the Professor of Law at New York University. And Philip teaches international law, human rights law, economic and social rights, and strategic human rights litigation. Hope that's all right, Philip. And from 2014 to 2020, he was UN Special Rapporteur on extreme poverty and human rights, in which capacity he visited the UK in 2018. And as you know, today's conference marks 5 years since that visit. Before that, he was UN Special Rapporteur on extrajudicial executions, monitoring unlawful killings around the world. I'm very pleased to introduce you to Philip, who will say a few remarks. Philip, over to you.
Thank you very much, Jess. It's a great pleasure. I wish I could in person, but childcare responsibilities prevent that, even at my advanced age. It's also wonderful to see at least the back of the head of a wonderful successor, Olivier de Schutter, who is with you. I want to make a couple of reflections on the visit that I undertook 5 years ago, and then offer some reflections on how we might approach social rights in today's context, and particularly to emphasize what's happening in relation to the National Health Service. So one of the things that was most striking in my visit was the gap between political perceptions and the reality on the ground. It's something that I still see happening today. So, for example, Philip Hammond, who was then the Chancellor of the Exchequer, was interviewed on BBC TV, and he said, "I completely reject Alston's report." And then he sort of said indignantly, "Look around you. That's not what we see in this country." And at one level, he was telling the truth, because the government had convinced itself that a small number of statistical indicators captured what was really going on in the economy and the society. But they apparently had never been out and listening to the people who were being dramatically affected by the policies that had been implemented since 2000. Second issue that is still a very live one is the role of local councils. I remember so vividly some of the discussions that I had, particularly with the leaders of the Newcastle City Council, where I learned of the extent to which so many of their activities had simply had to be abandoned. Today, there are 114 councils in England, Scotland, and Wales that have a budget gap of over £10 million. a total of £3.5 billion deficit overall. Local councils had parks, libraries, community centres, care for the elderly, youth centres, and a whole range of other absolutely central services. Those have been decimated, and this destroys the social fabric of those communities. Next point is food banks. I remember talking with a government minister who said that he thought food banks were actually a good thing because they enabled community solidarity to be expressed. But in fact, food banks represent desperation and abandonment. I don't know how many of you remember the wonderful film I, Daniel Blake, but when the main protagonist went to a food bank, she was filled with shame and humiliation. The humiliation really should be on any government that permits the abdication of those responsibilities. The final issue that I'd mention is the evolution of the legal system within the UK. Between 2010 and 2019, over half of the courts in England and Wales were closed. The Law Society, which is hardly a radical group, has pointed to the negative consequences, especially for those from low-income households, those with disabilities or mobility issues, those with children or caring responsibilities, and those from rural areas or who don't have access to a car. There are 8,000 fewer prison officers than there were in 2010, 10% fewer frontline prison staff, and the system of legal aid for civil cases was effectively destroyed overnight. It's astonishing that the UK, which historically is centrally linked to this conception of the rule of law, has seen over the past decade a fundamental hollowing out of that system as far as it is designed for the ordinary person. Looking ahead, we need to think about, to frame the sort of agenda that you are discussing today. I have to say that I love the framing of everyday rights. You will, of course, have been following much more closely than I have the ways in which the tabloid press and others distort human rights and present them as rights that end up protecting only drug dealers, refugees, and others. But part of the blame for that is with the human rights community, because we have not focused on what you are calling everyday rights, to emphasize that the things that in fact most people value very highly, such as access to decent education, access to food, access to healthcare, are among the most fundamental human rights issues in any society. I think it's very important to appeal to local perceptions, to acknowledge the pretty significant differences between, say, Scotland and England, or between Wales and Northern Ireland. I'm not myself convinced that talking about these rights in terms of international law actually resonates much with people in most parts of the UK. I don't think we should talk about these in abstract terms. I think we need to bring the reality of the denial of food, education, healthcare, the neglect of people with disabilities, the radical neglect of people with disabilities, the hugely negative gender consequences of ignoring social rights. And we need also, of course, to turn that into a positive agenda for the future. Let me finish just by talking very briefly about what I see to the National Health Service. I've spent a lot of time over the last 5 years studying processes of privatization, and never have I seen such a perfect case study as what you are now all living through. There's a recipe and it's being followed perfectly. You reduce the money available for key services. You let the staff run down and you overwork them. You wait for the waiting list to get longer and for people's frustration to rise. And then you do what Blair Institute for Global Change did in July of this year. You put out a report that said, this is terrible because the NHS is so valuable, but we know how to save it. We have to partner with the private sector. And we saw during COVID-19 how brilliantly successful it was when the then Conservative government teamed with the private sector. It was a disaster. The private sector is in health to make a profit. And that's how it should be. But if you turn the essential functions of the NHS over to the private sector, you will see a perfect replay of what happened to public transport throughout the United Kingdom after Margaret Thatcher privatized it. And the only system that continued to function very well was in a small town called London, where privatization did not take place. This is the playbook that is now fully being activated in relation to the NHS. So in conclusion, I just want to say, I think the framing of everyday rights is perfect. It gets it. I think we need to go back to the theme that poverty and deprivation are political choices and not simply a function of economic factors beyond our control. And we need to place a right to healthcare at the centre of the debate going forward. Thank you very much, Jess, and thanks to Just Fair for the great work that you've done.